Hello, I'm Peg Bolgioni, Marketing and Communications Manager for Southern Vermont AHEC, and I'm pleased to welcome you to our first edition of Let's Talk. Our programs will be focused on topics surrounding health workforce development in Vermont. The first show will be a discussion on AHEC health career pathways. Southern Vermont AHEC is a nonprofit educational organization dedicated to growing and sustaining Southern Vermont's health workforce, especially in our rural and underserved communities. I am very pleased to welcome my AHEC counterparts today. We'll be speaking with all of them. I'd like to introduce Jennifer Scott, our Executive Director, Amanda Richardson, the Director of Health Careers Exploration, and Susan White, the Director of Health Careers Preparedness, correct? Did I get that right? Okay, great. So we've got a lot to cover, and so we're just going to dive right in and start our discussion. So Jennifer, I'd like to start with you. Can you please provide our viewers with an overview of the AHEC program and, of course, Southern Vermont AHEC?
Of course. Well, Southern Vermont AHEC at its core is a health workforce organization, and it stands for Area Health Education Center. We fondly refer to it as AHEC, but it's not unique to Vermont. The AHEC program is a national program that was established by Congress in the early 1970s. And the point of AHECs across the country is to increase the health workforce, health professionals in medically underserved areas. So Southern Vermont AHEC doesn't do this work alone. We are really excited to be working with other organizations across the state in what we call the Vermont AHEC Network. And that's made up of our program office, which is housed in the Larner College of Medicine at UVM, and our regional centers where we have our Northern Vermont AHEC, the northern part of the state, and Southern Vermont AHEC that covers the 5 southern counties. The neat thing about AHEC is that it can creatively adapt the national issues to meet local needs. And so that's how we contribute to our health workforce development.
I know Vermont is going to need 9,000 health workers over the next decade. So how would you envision Vermont in places like Southern Vermont AHEC helping to address that challenge?
Well, you said it. It's not news to anyone that we have a health workforce shortage in Vermont and across the country. And we've been working on this for decades to bring strong, qualified workers into the health workforce so that we have a qualified and trained and diverse workforce across the nation and in our state. One of the things that AHEC does as an organization in the state of Vermont is we build pathway programs, from introducing students as early as middle school and high school, through offering college internships, to then supporting medical students out on clinical rotations, particularly in our rural areas, and then also supporting our health practitioners as they practice across the state. All of those programs and projects are things that AHEC engages in across the state.
And so that brings me to Amanda, because I think this is a perfect segue into what you do for the organization. And I know a couple of our signature programs that you run are MedQuest and Advanced MedQuest. So can you please tell us a little bit about them?
Sure. I get the fun job of getting to offer career exploration programs for students, particularly high school and middle school students. Advanced MedQuest and regular MedQuest, as we like to call it, are exploratory programs that are offered in the summer for high school students. And they are really intended to be great ways for students to explore career options within the health field. We offer them as day programs, and we offer sessions that are locally based at our healthcare facilities in Southern Vermont. Our partners help us provide opportunities for students to do job shadows. We have Larner College of Medicine students, so medical students, come down and work with our students one-on-one to provide activities and pique their curiosity into what it's like to want to go into medical and health professions fields. They're intensive programs, but really intended to be fun and exploratory in nature.
So if a student was interested in pursuing a health career, I know there's foundational courses that they need to take, but what else should they be doing to prepare for this type of career?
Sure. I mean, I think everyone can sort of knows that, like, oh, science is really important for, for health, right? So yeah, of course, science and math and those sorts of things are really great. So doing well in those classes and, you know, making sure that that's an interest of students. But we really do talk about how there's a health career for everyone, and we really want people to be excited and wanting to work with other people, right? So doing community service and volunteer activities is a really great way for students to figure out whether they like that sort of interaction with people on a day-to-day basis. It also sort of opens, you know, the doors to other things. Asking questions, so when students meet health professionals, asking them about their career is really helpful and important. And, you know, I found that health professionals really like to talk to students about their jobs. Also, of course, talking to their high school and other guidance, you know, teachers and guidance counselors, those sorts of things are important. But really curious, being really curious and asking questions.
All right. So what do you think, in your experience, is the primary reasons students, I should say, decide to pursue a health career pathway?
I think it's a lot about opportunity, right? There's a lot of opportunities. I don't know how many of you have seen this really awesome brochure by the McClure Foundation and the Vermont Department of Labor, but it lists job opportunities that are expected to have lots of openings with high pay, so high demand, high pay opportunities. And if you look through the list in the brochure, which I know is freely available, there's so many in health careers. It really points out that there's so many opportunities for students available. The other thing about health careers is that it's a career ladder, right? There are options with multiple entry points that allow students and, you know, potential employees to work their way up the career ladder. So it isn't a situation where you do a ton of schooling and you do one thing. That is an option, but there are lots of entry points and lots of flexibility. So so many, you know, jobs require very little training beyond high school, so just a certificate, and they can be working right away or even start working and earn that certificate while they're working with apprenticeship programs. We have lots of those going on around our region. All the way up through, you know, needing graduate degrees to be something like a physician, but there's so many in between. I think when I talk to students and hear about what they want in a career and what lots of people want in a career is really feeling like they're making a difference in the world and contributing to society in a really positive way. And I think there's no doubt with all the variety of health careers that you're going to be doing that. So I think making a difference, having all of those options with, you know, low entry points and lots, you know, with little training all the way up through, you know, and being able to expand upon that career and sort of shift around and move around. So many choices that are great for students and really awesome opportunities in Vermont.
That's excellent. And another rung on the career ladder is our internships. And so I want to ask Susan about that. We have a program called C-SHIP, and so can you please tell us a little bit about it?
Yes, thank you, Peg. Yes, College Student Healthcare Internship Program, or C-SHIP. We started it in 2013. We had identified a gap in our programs, or our pipeline. We have the Health Career Exploration Program for high school students that Amanda talked about, and we have programs working at the graduate level with medical students, but we didn't have anything for college students. So we started C-SHIP. We called it a leak in our pipeline, identified as that way. And since 2013, in the 10 years, we have placed close to 100 students. So C-SHIP's internships are non-clinical. They are paid, part-time, project-based placements with organizations and agencies with which we have partnerships. So we've placed students with hospital community health teams, with healthcare agencies, primary prevention coalitions, public health organizations, any nonprofit organization that's involved in healthcare in a very broad sense. Positions are competitive. To apply, students there's an online application process for students. They can go onto our website, or we use a social media platform that the colleges use for their career centers called Handshake. And again, it's an online application process, and they upload their resumes. These internships are remote. Some of them are remote. They became that way after the pandemic. So they can be done remotely as a project. They can be in person on site or a combination of both. They generally are 50 to 100 hours. So they are only part-time.
So what do the students say to you about their internship experiences?
Yes, there are certain skill sets that they learn, and that's sort of what the value of an internship is, developing some career competencies. So they talk about improving or enhancing their time management skills, gaining confidence, experience working closely with a supervisor, and presenting like to an organization's board or a committee of professionals. This is something students might not have had occasion to do. They might have presented in a class, but not to healthcare professionals or organizations. They learn, and depending on their project, they learn how to do research quickly and thoroughly. Some students have learned survey skills, how to develop questions and get the answers that are most helpful. And then I think even just as importantly, they learn how much more there is to healthcare than just doctors and nurses. Some of them have said, it takes so many people to create holistic care and each person counts. I had no idea that there were so many jobs in healthcare that are not in a medical setting.
One of the things, I had the privilege of speaking with a number of C-SHIP interns about their experiences, and I think what seemed to resonate the most was the giving back, the public service component of it. They really, really enjoyed that, to be part of policy making or creating surveys or doing something that had to enlist feedback. Mm-hmm. They loved the patient contact or the contact with their peers. So yeah, they just couldn't say enough great things about their experience, and so that's always nice to hear. But so you mentioned some of the benefits of a C-SHIP internship, but what distinguishes a C-SHIP internship between another type of college internship?
Well, first, internships in healthcare are really difficult to find. So students are very eager. I get lots of applications from students who are excited about that. So our internships can be remote and flexible, which is a big benefit to college students who are also working other jobs in the summer or possibly taking classes. Again, I think it's mostly that they expose them to healthcare in a non-medical setting that they had no idea about. I often get students who had no idea prevention is actually like a career pathway that they could do. And it enables them, just like most internships, but it enhances their employability. And in today's market, that's a real benefit to college students.
Yeah, definitely. And I know the application process is competitive.
Yes.
Very competitive. How many internship placements are you planning on for this summer?
We'll be between a dozen, 12 and 15, possibly more if some are part-time. We started out at 5, so the first year we had only 5 interns, and I can get close to 100 applications for those dozen, 15.
Yeah. And I know most of them are on a health career pathway, but are these internships kind of game changers for them in terms of, now I really know that this is what I want to do in terms of a job in healthcare career? It
can also rule out some things for some, but I think mostly it opens up options for students. They can come from a variety of majors and backgrounds. They can be, a neuroscience major that's pre-med, or they may be a health communications major, exercise and science fitness major. We take all majors. They have to have an interest in going in or exploring a health career. And we also, because of the mission of AHEC, we value rural and are trying to fill the gaps in our rural healthcare workforce. So students who have some experience in rural, or at least are interested in rural, is a priority.
So I'm going to bring this question back to Jennifer. How do we make our AHEC programs accessible to all students from diverse backgrounds? Because I know that's something that is very important to our mission and vision. So if you could elaborate on that.
Well, it's important to offer opportunities to all students. And that not only enriches the students' experience, but it enriches the the other students that are gathering and being around people from different backgrounds from themselves. I think it just strengthens their exposure to all kinds of things, different experiences that they haven't had. So in looking at the ways that we might go about doing that, we want to first make sure that students are aware of the opportunities that are at AHEC. And Amanda and Susan both spend a lot of time traveling around the state, in our region and across the state, to high schools, to technical centers, to colleges, at different fairs, conferences, different gatherings where students might be, where professionals might be that we can share our programs with. So it's making students aware of the opportunities first. And then the other part of that is reducing the barriers for them to participate in those programs. So we spent a lot of time trying to make sure that we're either reducing or eliminating barriers such as cost or travel time. So the location of our programs, maybe the length of their program. So Amanda spends time in classroom presentations, introducing students to the program. We've changed our program model to make the programs more accessible for students, whether it's in the summer or throughout the year. And I think also, after all is said and done, connecting those students with resources. So connecting them with VSAC, or connecting them with other health career resources like vermonthealthcareers.org. That's a website that is full of information, educational resources, and health profession resources for students, that is sponsored by the Vermont AHEC Network and is maintained by our northern counterparts at Northern Vermont AHEC. So making them aware, reducing barriers, and then connecting them with resources.
All right. So I guess looking ahead, what do you think is going to be important to integrate into AHEC programming in the future?
Well, one of the strengths of our AHEC program is our strategic partnerships, and so we have so many across our region and across the state, but we've been making some strides at deepening those relationships and engaging new partners in the work that we do. One of the things that we'd like to see is a deeper partnership with the Vermont State University, and doing additional programming through UVM and through our community colleges. So that's one thing that I think is really necessary. Our mission is to enhance community efforts to grow and sustain our health workforce. So one of the best ways to do that is to build and strengthen our strategic partnerships across the state, because we don't do this work alone. And I think there are some siloed activities across the state. So it's integrating those efforts, coordinating those efforts. And one of the other cool things that I'd like to see us do is to get more engaged with health career education and training technology. So integrating more AI, simulation into our student experiences, virtual reality. I think that really can have an impact on health professions training, whether it's nurses training or medical school. Simulation is a big thing, and I think AHEC is just starting to engage in that area and bringing that into our programming as well. It's kind of exciting.
Yeah, well, kids are very tech savvy today anyway.
So
Amanda
I can
and
add
Susan?
to the partnership part,
Yes,
because
please do.
our interns are not working actually in our office or with us. They're working with our partners in our community organizations. So I'm always looking for expanded partners, community organizations, agencies that could use a college student intern. We can't do it without the partners, as Jennifer said, and I can recruit students, but I also really need some sites and organizations that could use the fresh brain and mind and eye of young person to help them with project and expand capacity.
And I'll tag on to something that Susan said earlier. One of the opportunities that we have is, Susan mentioned that we can have 100 applications for our internships. And what we'd like to see is maybe being able to build some team internships, so placing several interns on a regular basis with our partner organizations. Yeah. So that's one thing that we're looking into, because there's a huge opportunity in being able to have so many interested students and so few sites. So I think that's one path that we're going to pursue, is to have more team placements.
All right, excellent. Amanda, did you have anything you wanted to add to that, or?
I mean, not specifically.
No, I wasn't trying to put you on the spot. But well, maybe I'll ask you this question.
Sure.
I know you spoke very eloquently about how students can get excited, how you try to get students excited about health careers, and our students, they're surprised to know the options that are available to them. Can you tell us a little bit about some of the activities that you do with the students?
Sure, I'm happy to do that. So I think one of the things that I really enjoy doing is going into classrooms, right? So when I go to a classroom, I obviously chat with the teacher and ask, what the expectations are and what the sort of needs are or interests of the students. But in addition to that, I really like to bring hands-on, pretty active activities with me that sort of meet those needs. So, I like to give that tactile sort of active learning style is really where I like to go, because I can talk at a student, but that's, they get a lot of information all at once in school. And so really bringing things that they can do. So one of the things we have suture kits, which are reusable kits that you can learn what it feels like to suture in skin, but it's not skin, it's so super safe, and it's that just trying it out. Of course, no one becomes proficient at suturing. It is really an activity intended just to sort of give them a feeling of what it might be like to get to do that as part of a career. Other things we do, we like activities related to health empathy, right? So empathizing with different conditions that people live with day to day. So we have, different stations where we emulate different conditions that lots of people in their daily life experience, where students get to sort of see what it's like to be in someone else's shoes and try that out and sort of get that perspective. We have activities related to mental health and behavioral health, really getting to sort of think, about what it's like to sort of be planful about those sort of activities. So in addition to promoting their own wellness, really thinking through what are things that people talk about who work in that field. So really lots of hands-on things. I have a really fun activity involving teamwork, which involves Mr. Potato Head, which is really fun. If they're laughing because
we've all done it.
Because everyone's gotten to do this activity.
That's
and
right.
It involves lots of different pieces and a really sort of fun scramble to sort of figure out what it's like to work as a healthcare team in a very low stakes simulation. So that's really great too. So I like to do lots of hands-on things, as well as talk about all of the careers under health, which range from everything from public health, which we're looking at community-based things, so that wouldn't be directly patient-facing, all the support roles in the background that students really don't think of, and then of course all the clinical things that I think students are sort of, when you say health careers, people immediately think of, but really trying to talk through all of those options, because we are in serious need of all of them locally. So.
And Susan, working with college students, have their interest in health careers changed over time? What are you seeing for trends now?
I think these are students who've just lived through the pandemic and were pretty impacted by it. And so I think there's more students at least aware, and if not interested, in public health. Some students will tell me they were taking an epidemiology class during the pandemic, so they were watching science unfold in real time, and that sparked interest. And I think that these are also students who've kind of grown up in the world of prevention, people coming and talking about, the risk of substance abuse and misuse, and so an opportunity, and to eat healthy, exercise, the wellness movement has definitely taken hold with students, or at least they've been aware of it, and I think that has sparked interest in, again, some of those expanded careers. I think on a larger picture with our healthcare world, certainly wellness and prevention and the social determinants of health are playing an increasingly large role in our healthcare world, and students are attracted to that. They can see the benefit and the interest in that. And I think that, so I think all of those things contribute to, and also just because, as Amanda talked about, and Jennifer have talked about, the huge amount of workforce needs that we have. So it's a great field for students to think about.
Yeah, and I want to go back to that workforce needs, and I know we've had discussions. It's been an ongoing refrain that we are in dire straits in Vermont in terms of our health workforce, and AHEC is very unique in that we are laser focused in trying to, create these opportunities for students. And I know we talked a little bit about medical schools and physicians and rural and underserved communities. I guess I'm asking you, Jennifer, if we're trying to get more primary care physicians, for example, to practice in Vermont, what should medical schools be doing in order to get them to stay here, or to at least be, have that experience of rural healthcare?
Well, it's pretty well known and well researched that one of the best predictors of practicing in a rural area is that you come from a rural area or you have family ties to a rural area. And we can talk about all the wonderful things about practicing in rural areas in terms of just the physical beauty or the diversity of cases that you get to work with, whereas in an urban area, you usually refer out. You specialize in your scope and then you refer out. But in rural areas, you are the provider. You have an opportunity to expand your skills in lots of different areas and to build deep relationships with your patients. I mean, it's wonderful to practice in a rural area, but we know that the real predictor there is that you come from a rural area or you have family ties in a rural area. So this isn't news. We know this. And in our medical school, Larner College of Medicine, they build clerkships in the medical students' third year and bring them to practices in rural areas across the state. So that's one way that we're already doing that, where we're matching students with an interest in practicing in a rural area with our rural clinical rotations. So it's just getting those folks in the area, making those connections, because those clerkships or residencies, if we were to build rural residencies in the state, that's where the next job opportunity usually comes from. So it's, it is a pathway in and of itself. And so it's important that they engage in the community, that they get to know the community, and then they build those networks and relationships and want to stay in the community. So we certainly value those students that come to our area, and it's really fun as an AHEC in lots of different ways that we engage with them while they're here.
All right, well said. We're kind of winding down our time, so I wanted to give all of you an opportunity to say anything you want to say before we end the program. If there's something we just didn't talk about or something you want to reemphasize, the floor is yours.
Well, I'll just add one other thing, that as an AHEC organization across the state, and it's probably similar in other areas of the nation, but our vision is that there's increased access to care for all Vermonters. And so the way that we go about contributing to that is by trying to increase the health workforce. If there are enough qualified and trained healthcare workers in our state, then that in and of itself increases access to all Vermonters. And that's really what we're aiming for through workforce development.
All right. Susan?
I can just say that I think the medical world a little bit is leaning more toward, the healthcare world is leaning toward team approach to healthcare, and I think that some of our pathway training programs are very much geared toward that. You mentioned the programs that you do with the high school students, and undergraduates are certainly doing more of that kind of learning in their classroom, which then can be applied to the workforce. So I think that's in our favor, both for the healthcare world and our programs and the way we run them. So,
all right.
I think it's just exciting. It's like there are so many opportunities in healthcare for both students and, people working in other professions who maybe are thinking that they want to career switch.
That's right. So
there's so many entry points, so many different options, and behind the scenes, patient facing, all of those sorts of things. So it's a nice time to sort of explore that at the moment. So,
and if you don't like working with sick people, you can still go into healthcare.
Yeah, that's right. That's right. Those jobs will never go away.
That's right.
Yeah.
All right. Well, thank you all for being part of our first show. And I encourage all of you who are watching to please visit our website. It's www.svtahec.org. And also, please visit VermontHealthCareers.org as well for any information on health careers. And thank you for watching, and we'll see you soon.